Hi, I'm Carrie Med, and this video is for Sims 440, activity number 9, and it reviews the roles and functions in case management. In case management, it's important to keep in mind that the term role is very similar to like job title. The function is what they do within that job title. For example, if you're an advocate for your patient, you bring up concerns that need to be addressed on their behalf. The Case Management Institute does a wonderful job outlining various roles and functions within different settings for case managers, because case managers are not just in healthcare, they're in a wide range of different functions within our society. I'm going to go ahead and review various roles and functions that are in acute care, home care, and primary care settings. For acute care setting, that would be for a short-term facility. A case manager may or may not be an RN. They may also be a social worker, depending on the facility. They are in charge of coordinating meetings with all the team members. That would be regular meetings between interdisciplinary team members that are working with the patient, such as specialist, rehabilitation, wound care, or social services, and more. They also confirm benefits and services allowed via insurance. This would result in working with the admitting department and insurance provider to ensure that the patient's services are authorized and benefits can be verified. They also facilitate referrals. So they establish where the patient's going to be going for referrals such as physical therapy, rehabilitation services after they leave acute care, and any referrals to specialists. They also will set up those first meetings if there's going to be referrals to someone that's not on like a rehab facility. And then they also are in charge of discharge planning. They begin discharge planning as soon as the patient's admitted to the facility. And that's to ensure that all areas of care are covered for that patient. Because remember, a case manager sees a patient from A to Z. They look at the patient as a whole, not just a specific disease. Case managers that work in home health, that also could include palliative care, hospice care, and caregivers for patients depending on their needs. Often with home care, case managers are registered nurses and act as an RN in that function. They also help manage the care for the patient. And there's usually teams for that patient. Roles and functions in that setting include acting as a liaison with providers or their actual healthcare team, which would include doctor, social worker themselves, and the nurse, maybe CNA. Communicating with the physicians that are treating the patient. They provide support and education to the family and the patient. And they determine if additional service such as medical equipment may be needed or wound care might be needed, and they help coordinate that care. In a primary case setting, case managers may work typically in a physician's office and help mitigate the needs of patients that are seen by the primary care provider. The focus is primarily on preventative care, and they include working on many areas, but they focus on screenings and wellness programs such as like diabetes or weight loss management. They have a focus on risk assessments, and they determine patients that are high risk for various diseases in order to help mitigate them prior to any illness. So maybe you have patients that have heart disease or the beginning of heart disease, and you want to try and help them prior to their health getting worse. So they would focus on that. And they also can help with telephone triage. An RN in that role would be able to provide telephone triage to patients as needed to determine if the care can be provided in the office or if it should be handled in an emergent situation. And there's several other things that they do in a primary care office. They help with disease management. That's assisting patients with managing their existing diseases or comorbidities, like we talked about, such as heart disease or diabetes. Those are great examples that everybody knows. The end result would be to have better long-term health outcomes. They assist in facilitating access to services, so that may be including rehabilitation or maybe physical therapy. They educate and refer patients to community-based resources. So that might be something like Meals on Wheels or free senior transportation, or maybe even the Parkinson's Education Center that's free for them. I know Phoenix, Arizona has a wonderful Muhammad Ali Parkinson Center that they have lots of different activities and different education and support for not just the patients, but their caregivers. And that might be a referral from their case manager. And they also educate patients on treatment and ensure that they understand the treatment plan and that they're compliant, or as compliant as they're going to be with the treatment plan. In order for a nurse to be prepared to complete a community health plan for a patient, it's going to be important for them to understand the community that the patient lives in, any health detriments that there are, and be able to evaluate the different areas in the community that directly impact the patient. Being an effective case manager requires the ability to listen to people and to accurately assess their problems, be able to offer a range of diverse and innovative interventions, and follow up on their progress towards their goals that they have set for themselves. And it's important as case managers that they're consistent with that. Additionally, case managers would need to have an understanding of the community resources that are there and available for their patient. They're also going to have strong communication skills in order to work with those resources and educate the patient and the resource team as necessary. Different resources may include medical care, support groups, educational opportunities, social activities, and possibly even legal counsel. Case managers work diligently to promote quality care with the least cost to all those involved. There are several different approaches that a case manager can use to help promote the highest quality of care with careful use of resources. Approaches may include including the patient in planning for their care. Patients need to have their case manager act as an advocate for them. They also need to allow them to have autonomy to decide the care that they need or want. Including the patient in the planning affords them the opportunity and also increases the likelihood of compliance. The more times you have to have a patient try and do something or to work towards a goal, and you do it over and over and over again, the more resources you're wasting. So if you can get them to be compliant the first time, you're going to be very successful with them, and it's going to be better for them in the long run. They also provide follow-up calls to patients to ensure adherence to care plan and any changes or questions that may be considered. Often patients may not remember all of the details discussed in person, or maybe they have more questions now that they're home and they've discussed their situation with possibly their loved ones or their caregivers. Case managers need to have those follow-up conversations to ensure that that patient is getting the highest quality of care and has a good understanding of what their plan of care is. They address finances in the initial interview with the patient so that the financial resources and limitations can be considered when creating that plan. So when you're including that patient at the beginning and you're having them help you with that care plan and be involved, that's when you're asking them about their insurance, about supplemental insurance, about federal aid, in order to determine what all is available to them and what's the best care that they can give for the least cost to them and to everyone else involved. By using different approaches, the quality of care can improve with their patients. It does help decrease the use of unnecessary resources to keeping open communication with the patient and their families. So overall, case managers, although this specific one we're talking about is in healthcare, they have a lot of diverse roles and responsibilities, regardless of what setting they're in, whether it's acute, home care, or primary care providers. They definitely have big shoes to fill, and they're very much needed in order to advocate and to be there for our patients. Thank you for watching my video.